Strabismus, squint crossed eyes, string eyes is a term used to describe any misalignment of the eyes. It affects 4% of children younger than age 6. It is usually an isolated problem in children but can occasionally indicate an underlying pathology. Early diagnosis, appropriate referral and treatment are essential to prevent the development of amblyopia, that is visual loss, which occurs in 30% to 50% of children with strabismus. History, age of onset, circumstances eliciting the deviation and associated visual complaints, prematurity, prenatal drug exposure, fetal alcohol syndrome, cerebral palsy, developmental delay, chromosomal and genetic anomalies, a family history and evaluation of family photographs for corneal light reflex and red reflex. Careful examination should result in being able to classify the problem as a heterophoria, latent deviating under certain circumstances, or heterotropia, constant, paralytic or non-paralytic, and inward turning iso or outward turning exo, based on the nature of the defect and the child's age at the time that problem develops. Many cases can be identified as a specific clinical entity. Screening tests: red reflex, corneal light reflex, cover-uncover, alternate cover test, plus minus visual acuity test if more than 3 years. If tests are normal, then there are two possibilities: intermittent eye crossing in infants or pseudostrabismus. What is intermittent eye crossing in infants? Intermittent transient eye crossing is normal in infants in the first 3 months of life. It is also known as ocular instability of infancy and frequently occurs when infants are tired. So what is pseudostrabismus? A wide flat nasal bridge or prominent epicanthal folds may create an optical illusion of in-turning eyes, that is pseudostrabismus. Careful assessment of the corneal light reflexes confirms that the alignment is normal. If there is abnormal red reflex and or visual loss, then there are two possibilities again: retinoblastoma and sensory strabismus. What's retinoblastoma? Strabismus may be a presenting symptom in children with retinoblastoma along with leukocoria. Sensory strabismus is sensory strabismus occurs when there is a severe vision loss, unilateral or bilateral, and there is subsequent loss of ocular alignment. It may be accompanied by sensory nystagmus in children with severe and early vision loss. If deviation constant in various directions of gaze, absence of identifiable neurological, mechanical, sensory deficit, then either it's infantile esotropia, acquired esotropia, or infantile exotropia. What's infantile esotropia? Infantile congenital esotropia appears before 6 months of age. There is often a family history of strabismus. What's acquired esotropia? Acquired esotropia is often accommodative. The eyes turn inward with attempt to focus. Onset is typically between 2 and 3 years of age. Acquired esotropia may follow a period of occlusion of one eye. Infantile exotropia is less common than infantile esotropia and is more frequent in children with neurologic abnormalities. Strabismus can be paralytic due to cranial nerve palsy, 3rd, 4th, and 6th. Restrictive strabismus is due to mechanical forces such as inflammation, edema, trauma, or congenital disorders resulting in fibrosis. Treatment is on the basis of underlying cause. Early referral towards ophthalmologist should be made.